introduction. My goodness. Thank you, Stephen. It's really overwhelming. I never expected such an event. I want to thank CJ for such an introduction. I also thank the trustees of Auburn Memorial Hospital, especially Pam Kirkwood, who's an old friend. Judy Mantillo, or Santillo, oh dear. I have to be sure I can see one. And Lynn Jones, who made so many arrangements, and everything is just perfect. I'm very pleased and honored to be honored. It's wonderful to see so many friends, colleagues, nurses, and patients. When I arrived in 1950, it was so helpful to come to a city that was used to lady doctors. There had been lady doctors since 1871. That was Amanda Sanford Hickey, and she came and was a very impressive lady who did many very excellent things in the community. Mary Kirkwood was here, and also Lillian Tree, both lady doctors. Dr. Mary and her husband, Dr. Alan Kirkwood, became our very good friends. And, she did obstetrics and gynecology. Dr. Tree had given anesthesia for many years. And she had retired when I came, and she was just the nicest lady around. Super. Anyway, I have to tell you how I met Dr. Robert Worden. I was very enthusiastic and ready to go. First day of internship, I got at the Lenox Hill Hospital nurses' residence. The ladies did not stay in the interns' quarters because that would have been a real no-no. So, to the nurses' residence, I went up to my room, and they had told me that my uniforms would be there. They were not. So I went down to the desk, and I said, what do I do? My uniforms aren't there. And she said, well, they're probably at the laundry. So the laundry is down 2 blocks, and that way. And so I ran that way, 2 New York City blocks, which are considerable. And then I ran back because they said, we sent them to your room. So I got up to my room, and I put on the white blouse, and white skirt, and white jacket with the stethoscope in the pocket. We did not put stethoscopes around the neck, ever, in the pocket. And hammer and the tuning fork in the pocket there. And so I went as quickly as I could to female 5, which was the ward I was assigned to, and Dr. Robert Worden was the chief resident on female 5. So I came waltzing in as quickly as I could, and he looked at me and he said, you're late. I said, I'm sorry. And he went over to the chart rack, and he picked up 2 charts, and he handed them to me, and he said, read these, sit over there, and don't bother me. Right. Anyway, it turned out that it was a grand rounds day, and grand rounds in those days were something. It was once a month, and we had 2 separate surgical services at Lenox Hill. I was with Dr. Donahue, who was the boss, and Dr. Pickard was the other one. Mine really had nothing to do with the whole time I was there. Anyway, you went on grand rounds, and you had both sections. You had all the attending surgeons, you had all the residents, all the interns, all the assistant residents, you had all the chief nurses, and you went first to the ward, which was a very large room, about the center section here. And the beds were all placed around, feet first, so as you went around, feet were facing them. And you went to each separate bed, and the patients loved it. They were delighted if they were asked a question, and for the first time, they knew exactly what was happening to them. They heard the histories, they heard the procedures, they heard the ones that didn't get procedures, the ones who did, the recovery, the whole kit and caboodle. So that took my time. Then we went to male 7, where you had the same procedure, all same ward setup, and all men. So we went all the way around, and we came to the last patient, and Dr. Donahue, my chief, said to me, "What's your diagnosis?" And I looked at him and he said, "I don't know." And we got to be very good friends later. And you can see that Dr. Baum and I got to be very good friends later too. Now I got to see where I was. Anyway, there were lots of doctors in Auburn at that point. We had all the fellows who had gone away in the war, and the ones who had come back, the ones who had extra training, and we also had old doctors who took care of all the people in Auburn, all during the war. And I have to say that they were all most receptive, helpful, anything that they could do to assist me, they did, and never had anything but good relations with all of them. It was wonderful. We got to know each other because we had 4 meetings a month. You had a meeting at Auburn Memorial, you had a meeting at Mercy Hospital, you had a meeting at the Cuba County Medical Society, and then you had a 4th meeting, which was a clinical pathological conference at Memorial. It was a lunch conference, and at that time, the lunches were marvelous. They really were. And for dessert, they always had vanilla ice cream, and you had your choice of chocolate sauce or strawberry sauce. It was delightful. But you got to know all your colleagues. It was just wonderful. And then, of course, I forgot, that's why I have my paper. We had the charity ball, which was, of course, for the hospital. And it was black tie, full dress. It was held at the Osborne House Hotel, which was marvelous. They had a great ballroom from here to there for dancing, and on the 2nd floor. And always had an orchestra, and everybody danced. I mean, with each other. Mercy had a cotillion, and the ladies' auxiliary also had a dance. So we got to know each other pretty well. I still marvel at the amazing advances in medicine and surgery. We must support the hospital and keep up with modern changes. Nurses and support staff are essential. If you're going to do good work as a doctor, you've got to have good nurses and good people all the way around. They really all should be thanked and all be told that you appreciate them. I always enjoyed when we had the nursing school. I was assigned, needless to say, to that committee. And it was a pleasure to have all these young women. Of course, you know, they lived in the nurses' residence. They didn't live at home. And it's very strict and everything proper. And the doctors used to give all the lectures, or many of the lectures. I was assigned infectious diseases, which I knew quite a little about, having had a few of them. But I want to thank you again for kudos for doing what I love to do. The one thing I always wanted to do was to be a doctor. And anybody who knew me as a doctor knew that I talked a lot. And the patients appreciate being talked to a lot. And then I have to say, I couldn't have done it, of course, without Dr. Baum. He was in full support of my practice and was extremely helpful. He knew everything that I didn't. I'm quite serious about that. You know, you take medicine, pediatrics, obstetrics. He had delivered lots of, he delivered a baby at Mercy Hospital in the parking lot one time. He was a superb surgeon. I had scrubbed with a lot of surgeons over the years. First at Bellevue and then at Lenox Hill. I didn't just scrub with him. I scrubbed with the gynecologists, the orthopedic surgeons, any of the scrubbing. I always loved the surgery. And he was just the greatest. And of course, he was the greatest at home as well. And as young Bob here would tell you, we had great times. I can only tell you, I'll only mention, oh, there's so many stories. But we used to have, they were very athletic, and Dr. Baum was very athletic. And they used to have what we called running through in the living room, where he would throw the football as either or Joe and Bob or Mark would run through and catch the football. I watched and held my tongue, and they never broke anything. I think that's a gift.